Okay, let's get started. My name is Whitney Nordvold, and I am the Great Plains Good Health and Wellness Program Coordinator here at the Great Plains Tribal Chairman's Health Board. Welcome, everyone, to this month's Community Health webinar. I apologize if my voice sounds kind of squeaky or scratchy, or I occasionally can't quite get the words out. I have a big baby bump and it's kind of squishing my lungs and my diaphragm a little bit, so my voice sounds like I'm like sick, but I'm not. So if you hear me repeat myself or I sound weird, that's why. So I just have a few logistical things. Please make sure that you mute yourselves. If you have trouble muting yourself, I can mute you also. It just helps keep background noise down. That way we can hear Ray clearly. I will post the evaluation link in the chat box. So please fill out the evaluation. It's really helpful for us and for the presenters to know any suggestions you might have or ways that we can improve this series. Let's see, next month, I'll have to tell you that at the end. I don't remember. I need to look it up. I don't have it right in front of me what we have next month. But our presentations or our webinars are always the second Wednesday of the month. So that will put us June 13th. So keep that in mind. Keep that on your calendar. Yeah, I think that's it. We'll have some, if you have questions during the presentation, please put them in the chat box. Otherwise, jot them down if you're calling in, and we will save those to the end. And I'm just going to read a little introduction, and then Ray O'Leary, she is presenting today, and she's representing Missouri Breaks Industries Research and the Chunley Coalition of the Cheyenne River Sioux Tribe in Eagle Butte, South Dakota. And yeah, you may have already read this, it's on the poster, so I'm just gonna give a quick intro here. Policies and procedures can be an essential part of any organization or community. Policies can ensure compliance with laws and regulations, give guidance for decision-making, and streamline internal processes. However, policies won't do your organization or community any good if they are not followed. During the webinar, Ray is going to discuss topics that will include different kinds of enforcement and encouragement of policies. So I will just hand it over to you, Ray, and take it away.
All right, thank you for the introduction, Whitney. I'm assuming everyone can see my slides. If not, put something in the chat box and Whitney can maybe talk you through that. Thank you for that introduction, and I'm excited to share on our experience on the Cheyenne River Reservation with enforcing a tobacco policy. So the outline of the content of the webinar that we'll go through today, I'll start with a brief history of the Chunley Coalition. Then we'll get into tribal policy process and getting into enforcing tribal policies, as well as some themes to lessons that we've learned over the years. And hopefully at the end we'll have time for some questions where you guys can ask about either policies that you're considering or maybe already working on, or have passed but need help with some ideas on enforcement. So we'll make sure we have some time for questions at the end. So just a little bit of background with the policy that I'll be referring to in my presentation today. The Chunley Coalition began back in 2009. It was myself and about 4 other people who gathered around a table, and we were all concerned about smoking on the reservation in indoor public places. It was in 2010 that the state of South Dakota went smoke-free, and of course because of tribal sovereignty, all the 9 reservations in South Dakota were exempt from the state's law, so that was not enforceable on the reservations. So it was about that time that we took it into our own hands and said, this is something that we want for our reservation, and we formed the Chunli Coalition for the Cheyenne River Sioux Tribe. We now have over 50 members that participate in our coalition events and meetings. So it's really been it's so great to see kind of a grassroots community level effort around a public health or community health issue. But between the years 2009 and 2015, this is just some estimates of all the activities that happened through the Chunli Coalition's work. We had approximately 72 coalition meetings that we do monthly. Like I said, we have over 50 coalition members right now. 6 years of continuous tobacco prevention messaging to the community. And that's through a variety of ways. It's through newspaper articles, handouts that go out to our food distribution program, our Head Start students, and the WIC program, all kinds of partners that help distribute our message. We've hosted 5 Kick Butts Day events with our local Teens Against Tobacco Use, which stands, or TATTOO is the acronym we use. We've done 3 media efforts to recognize smoke-free businesses. We've received 3 legal reviews from the ordinance that we drafted that was provided by a tribal attorney, which for the Cheyenne River Sioux Tribe is a necessary step to get an ordinance passed. We've had 12 presentations to the Health Committee in those 6 years in attempt to get the ordinance passed by our tribal council. And then 5 tobacco prevention parade floats that we do at our annual Labor Day parade, and 4 Great American Smokeout events. Following all this work over the course of 6 years, in May of 2015, we got our 3rd and final legal review on our ordinance. We got our ordinance passed by Health Committee with a unanimous vote, and then we went to our full council and presented the ordinance. And after being told no for 6 years, we finally got our tribal council to see the value of a smoke-free ordinance for across the reservation for indoor public places, and they passed the ordinance. After that, it had to go through a 30-day review period where the ordinance is posted in the newspaper, and the public is given an opportunity to submit letters to the tribal secretary or call in with their recommendations or their support or their lack of support for the ordinance. We made it through that, and on May 1st, 2015, the Cheyenne River Sioux Tribe officially was able to enforce the Smoke-Free Air Act for CRST. So that's kind of a background on my policy work with the Chunli Coalition, and that's the ordinance or the policy that I'll be referencing as I move through the slides today. This is a step-by-step process that we developed following passing our ordinance. We had a lot of other tribes calling us saying, you know, how do we do what you did, whether it was for tobacco or for another health issue. We had a lot of interest in people saying, you know, how can I duplicate this, or how can I do something similar for my tribe? So we came up with this process to help people. This is, I have to put the disclaimer out there, what the Chunli Coalition did to get the ordinance passed successfully. But of course, every tribe, or maybe you're representing a city, state, or federal government, they all operate in their own unique way. So it's important to recognize that. But this is just kind of a general idea of how to impact health by exercising tribal sovereignty using policy. So the first step in the process, and really, you know, I think in general, Native Americans are not very linear people. We don't like steps. We like to be able to kind of have some fluid motion and jump around through processes. And I think that's great, because I think all communities are going to be at different levels. But I would say the only thing that, as far as like an order goes in this process, is I would definitely recommend starting with that coalition building. And after that, all of these other processes are pretty fluid and can be moved around as necessary for your situation. So of course, you know, building that coalition, Then it's always helpful to have data that represents your region or your local area that relates to the health topic that you want your policy to address. It's good to research the local opinions regarding your policy and find out if this is something that the community in general supports or doesn't support. And then, of course, knowing what your council member or whoever your decision makers are, what their opinions are on the policy. The next is raise community awareness. So that just involves a lot of education, giving people a reason to care, talking about why this is important. Excuse me, I'm getting over a cold. Get to know the decision makers. So talking to them about, if this is something that they support. If not, what would it take to get their support? What changes need to be made? What community activities need to be done in order for them to understand that this is important and put their vote behind it. Of course, then developing that policy, write and rewrite that policy until you get it at a place that your decision makers can support. Always, refer to your coalition to decide what are deal breakers or what are non-negotiable items that, if is there something in the policy that we can say, okay, the council or the decision makers really don't like this piece, but we're willing to give that up? Or is that something we want to, have our convictions on and stick to our guns and not modify? Of course, lawyers are helpful at this stage when you're drafting your policy. The Chun-Li Coalition used the Public Health Law Center it's based out of Minneapolis, Minnesota, when we developed our policy. And then, of course, presenting the policy, so going before your decision makers and sharing what it is you're asking them to consider. And then in our situation, we had to go through this cycle for 6 years. We went through, re-energizing our coalition, getting more data, raising more awareness, talking to those decision makers over and over until we could be successful. And then eventually, after 6 years of working at it, we were able to get the policy passed, of course. And then that final key piece in the center there is enforcement. So promoting the policy by celebrating the success publicly, post signs, report non-compliance issues and fines as necessary, send out reminders to anyone affected, and continue to educate. So this is kind of the piece that we'll pick up on moving forward is this enforcement. Just to recognize, the different types of policies that might be out there. One would be just unwritten policies, but understood. So maybe there's not an actual document with somebody's signature on it saying that, this is official policy. Maybe it's just a case of, nobody's ever smoked in this building and nobody's ever tried. So people just understand that this is a building that smoking's not allowed in. And you'll see in the bottom right of your screen this thank you to the 126 smoke-free businesses on Cheyenne River Sioux Tribe. This is something that we did when we were kind of stalled out with our tribal council. We weren't able to get the policy passed. So what we did was started to focus on other places that we could celebrate that were smoke-free. So we went through a list of all the businesses on the reservation, and just through, talking word of mouth, as well as going to those businesses to observe, do they allow smoking there or not? And then this is something that we put in the newspaper to acknowledge them for having a smoke-free business. Along with this, if they were identified as not allowing smoking in their business, we sent a congratulations frame. We just printed off this 8.5 by 11 page with a congratulations to whatever business it was for protecting the health of Cheyenne River Sioux tribal members and your patrons and your employees. And it was kind of one of those things that we did thinking it wouldn't be that well received, but what the heck, it's worth it. But I'm amazed that I think this was probably about 5 years ago we did this. I still see these framed congratulation awards in businesses that I visit. People really took it seriously and thought that they appreciated being recognized. And it was also not only a congratulations to the business, but it was also a way to kind of unofficially get a smoke-free air sign in their building. It wasn't a smoke-free sign, but it did say congratulations on being smoke-free. So it was kind of an easy way to communicate to people that visited that location that it was a smoke-free business. And we didn't require them to have anything in writing. This was just if they allowed it or not. They got recognized. City parks or city policies, which in our case involved parks. This was one we really thought we were going to struggle with, but we were incredibly surprised that it just took a conversation. All we had to do was show up at the city council and present our case, and the discussion was kind of like, yeah, of course, why wouldn't we do that? So that's another type of policy. Of course, there's school policies that have to go through the local school boards. Excuse me. Organization policies. So it could be your business place that you work at, or maybe an apartment complex in your community, anything that represents an organization. Tribal law, of course, is going to trump all of this. So always a good place to consider for policies, but not the be all end all. It's important to think, if you're not able to get tribal law or an ordinance passed, maybe some of these other types of policies will do essentially until you can get the tribal council on board. I'm sorry. Powwows is another location you can focus. So for us, the picture kind of in the center there, we were able to talk to the organizers for some of the powwows in the area who were very supportive of smoke-free powwows. Rodeos is another option. And then, of course, personal policies. So maybe just encouraging community members on a personal level to make their home or their vehicle smoke-free in this instance. And of course, all of the things that I talk about are going to be related to tobacco because that's where my experience is. But I challenge everyone to think about other policies that their community might benefit from. So why tobacco policies? This is a really dorky, obligatory comic in my presentation. The real reason dinosaurs became extinct, smoking. So I just thought I'd throw that in there. But really, as a respiratory therapist and a nurse, tobacco was one area that I was able to get behind and say, this is something that I can be involved in that's going to make a big change for my community. So with that, I'm going to not talk about so much the Chunli Coalition, but I just want to reference a few things if you are interested in learning more about the coalition's story and how we made the reservation smoke-free in indoor public places. Here's a couple links that you can follow. The top one is a YouTube video that I made of myself just telling the story of the day that the ordinance was passed. The next one is a link to our Chunli Coalition's our webpage, and then the final one is our Facebook page where you can follow the different activities that we do moving forward. So now we'll get into enforcing policies. So this first one here is pretty obvious, just getting signs up. There's nothing verbal, it's just something that people see and know as soon as they see it that something is or is not allowed in that area. The two that you see in the left and the center were done in partnership with the Chunli Coalition and Great Plains Tribal Chairman's Health Board tobacco program, and these were an attempt to make them a little bit more culturally relevant, and using art from locals in the community, and then of course using our native languages to communicate. And I think what I really like about these is they have a positive message. It's not a negative, no smoking sign like you see standardly anywhere else you go. It says, let's be 7 generations smoke-free and keep tobacco sacred. Those are really positive messages, and they have this beautiful artwork. So I just love that it's a way to communicate your policy in a really positive way. The other sign that you see there is one that we did on a window cling, and we gave them to people who signed a pledge to make their home smoke-free. And it's nice to go across the reservation and see these posted in people's door windows or windows next to their entrance of their home. And again, we use local art on that. Another way to enforce policies is empower your community. So much of policy enforcement is going to come from your community. A lot of that involves working with key stakeholders from your community, or talking to youth and elders is where we found a lot of our power. So this yellow sign here says, "We must ask you not to smoke around us." And this is a picture of our Teens Against Tobacco Use, or our tattoo kids. These kids are amazing and have really taken a stand against tobacco in our community here. And they feel really empowered to speak out, and they're kind of known as the kids that are anti-tobacco in our community. And they're really proud of that too. So working with your youth is going to always be helpful if you can communicate. And again, in a fun, kind of a joking manner, we're able to communicate the smoke-free air policy. On the left-hand side there, you see a picture of a tobacco-free sign in one of our parks locally here. This is a city park. And we actually took this picture and then posted it on our Facebook page that has a lot of followers as a way to reinforce that, this park is smoke-free. One thing I like about our park policies, every council we went to said, how will this be enforced? And we were able to tell them that it's going to enforce itself. We're not going to, your law enforcement isn't going to be getting calls at 5 o'clock on a Friday night saying, hey, somebody's smoking in the park, you better come take care of it. It's more of a way for, let's say I'm at the park with my kids and somebody's smoking. If there's no sign there, I can't really do anything about it. I mean, I could tell them, I don't like you smoking around my kids. Do you mind putting that out? Or my child has asthma or whatever. But without a sign up, I have no merit behind what I'm telling them. But if that sign's up, it gives me, as a community member, the power to ask that person, did you realize that this park is smoke-free? Do you mind putting that out? And I've talked with a lot of the law enforcement in the area, and not one has ever said, we got a call because somebody was smoking in the park. It's just something that it's able to enforce itself through those signs and through empowering your community to speak up about the issue if they do notice somebody violating the policy. So next, since we were talking about law enforcement, sometimes the policy, if it doesn't enforce itself, you're going to have to turn to law enforcement. And different types of policies, this might not be an option if it's just like a school policy or an organization policy. But for our instance, because it's tribal law, we are able to use law enforcement. So what we did is on our signs at the bottom, you see enforced by CRST tribal law enforcement. And then on the one, we say, thanks for your cooperation, just to keep it positive again. The other message that we use on the left sign is what you permit, you promote. So this is kind of a reminder to both our law enforcement, if you know that somebody's violating this policy and you don't do anything about it, essentially you're promoting it. And also to like the business owners that have this in their on the door of their entrance. Every time they walk through it, they are going to see what you permit, you promote. If you're not following this, you're essentially promoting smoking in smoke-free environments. In our policy, it's a civil infraction that they could get for for violating the policy, but we haven't ever had to get to that point of the law enforcement issuing fines or citations for smoking in indoor public places. Next is friendly reminders. So this is 2 examples here. On the left-hand side, you'll see actually our letter that is just now going out to all the businesses. Every year on the anniversary of the ordinance passing, which is May 1st, we send out this letter. And each year we make it a little bit different and update it. And then we have our tribal chairman sign it. And basically it's just a reminder. We take text directly from the ordinance and remind business owners of what their responsibility is in enforcing this policy. what would happen if they don't enforce it, the fines that they could get that are associated with that. It also has an insert that we usually include to give to employees of the business that reminds them of their responsibility and suggestions on how to handle it if somebody walks in the business and starts smoking. And then every time we send this reminder out too, we ask people to contact Missouri Breaks if they are in need of new signs. If those signs got faded or wore out over the year, they can always come back and get new signs. So again, just reminding them that those signs exist and to check theirs and make sure they're in compliance with the ordinance. On the right-hand side there, this is something that we did kind of a media blitz with on the first anniversary of the ordinance being passed. This was a picture from one of our parade floats that we did. It says, "Happy anniversary, CRST. Thank a tribal council member for protecting us with smoke-free air for 1 year." So this has two purposes. The first purpose is to acknowledge our council members who made that really bold decision to vote for smoke-free air for their reservation. But it's also a friendly reminder. It's not saying, remember, our reservation is smoke-free. But by seeing this, people are going to have that friendly reminder. And then on the bottom there, it says Ordinance 77, no smoking in enclosed public places. It's the law. So it's always important to just get a little bit creative with your messaging and not be so in your face sometimes with enforcement of policies, but rather do it in a gentle and in a friendly manner when you can. Next is recognizing all stars for enforcing that policy. So what you see here is on the left, we ask businesses if they would like to be promoted by the coalition on our Facebook page for being in compliance with the Smoke-Free Air Act. And what we did is had them send in a photo of their smoke-free air sign posted at their business place. So again, it has two purposes. One, it's giving that business some acknowledgement and encouragement and promotion of their business by getting it posted on our Facebook page. And two, it's showing like this business is boldly saying, we're following this policy. You can't smoke in our location. And we didn't have a whole lot of replies of businesses promoting this, but what we did then was just went out into the community and took pictures ourselves and promoted these businesses that were prominently displaying their smoke-free air signs. And I'm happy to report, we're just at our 3rd anniversary here, that we can still drive any community in the reservation down Main Street and see all of these bright yellow signs posted in windows and entrances of businesses. There's very few that received that sign and didn't post it. We also use our coalition members as kind of our foot patrol. So if our coalition members notice that a sign is, damaged, or maybe a sign got taken down, or there's a new business that started that doesn't have a sign yet, every meeting we have a place on our agenda for coalition members to report non-compliance with the ordinance, or just new businesses or changed ownership that need a new sign, and then we take those out or contact that business place. Another thing that we did to recognize all stars, you see on the right here, this is a newspaper article that we wrote and submitted to our local newspapers, acknowledging one of the bars on the reservation who chose to go smoke-free prior to the tribal ordinance taking place in 2015. And this is, you can kind of see it in the clip there. That's a picture of the certificate of appreciation that we gave out to all the businesses that were smoke-free. So obviously, a bar is a pretty common area for smoking to occur. So we have to be a little bit strategic on how we promote the businesses. Of course, we can't do it for all of them, but this was one that we really were recognizing as being an all-star by going smoke-free. And I can tell you the experience of this bar in particular. The previous owner of it is deceased now. This is his son in the picture who took over ownership when his father passed away. That was one of his father's missions. He always said that he hated the way he smelled and the way he felt after working a night in his bar. And he tried different times to go smoke-free, and he just got a lot of pushback from his patrons. So he would always go back to allowing smoking. So this was kind of a extra special story because they were kind of able to do this in honor of him or in memory of him. And I think the patrons really had a lot more respect for it because it was kind of a memorial step that was taken. So kind of just to hit some themes and touch base on the major lessons that we learned on policy enforcement over the years with the smoke-free air ordinance on Cheyenne River. Sometimes it's just a case of asking. It might be easier than you think. We found that over and over again, we would think a different location or a different city council or a different park would be hard to make smoke-free, and we would do all this background work and compare our talking points. And sometimes you just show up and you're like, you have all these talking points ready, and the people you're presenting to are just like, yeah, of course, like why wouldn't we do this? That makes perfect sense. And you don't have to go through any of your talking points. So sometimes, it's easier than you think. It just takes that person taking the initiative to go have that conversation. And this applies to both creating a new policy as well as enforcing a current policy. It might just be a case of saying, we have this policy in place. I noticed that you didn't have a sign up. Would you like one? So just taking that step to identify those places that need attention in enforcement for your policy and having that conversation. Using children and elders to help share your message is a huge lesson learned. Very early on in the coalition's existence, we didn't have children. We had a few elders, but we met a lot of resistance. But what we found over the years is the more we used our youth and our elders to help share that message, the better it was received. Because really, who can say no to a kid or an elder? Get friendly with law enforcement. Or if you're in a situation where it's not law enforcement who is responsible for enforcing your policy, maybe it's the boss at your organization or the superintendent at the school. Getting friendly with them and let them know that, you're there, you're monitoring, you're watching, you're noticing that they're not enforcing the policy. Sometimes that's all it takes. Do what you can so policies enforce themselves. So this kind of goes back to empowering your community members. We've done different articles in the newspaper for how to talk to somebody about smoking in a smoke-free area, because it's a hard conversation to have. You don't want to feel like the police, but I think the more people realize that it's the majority that wants this, the more they are willing to speak out about it. So using data as your friend too. If you have any data that says, this policy or ordinance is supported by the majority of whatever the population is, that's definitely something that you can use to empower those community members to speak up about it, because they don't feel like then they're the only one that wants that. And that's really what you're going to be able to do to get policies to enforce themselves, is to work with your community members to be the voice behind the policy. Of course, if those things aren't working, you're going to have to report violations as necessary. I would say it's important to use that as a last resort. Do what you can first before you are reporting any of the policies that aren't being violated. But of course, if it comes up, you just have to take that step, and maybe it'll be just one infraction, or that is what all it takes to get that policy enforced. Again, give regular friendly reminders of the policy, and I emphasize regular, so you can't just do this once and think you're done, because we know that business ownership changes, employees change, tribal councils change, management changes. It's so important to not just do this once, but do it on an annual basis, or whatever it takes to keep that message present to whoever it is that is responsible for enforcing that policy. And then, of course, giving them the tools to know how to enforce that policy, such as the letter that has copy or text from the actual ordinance or policy, is really helpful, because then they know exactly what they're working with. Giving them the language to use with patrons who choose not to follow the policy. It's hard when you're in that situation where you're having to all of a sudden have that conversation if you haven't thought about it before. But if you've been given, information, or your employer has talked to you about this is how to talk to people about enforcing the policy, it's a lot easier if you have a little experience or exposure to that first from those friendly reminders. And of course, the final point there is persistence, patience, and partnerships pay off. Those are kind of the 3 Ps that the coalition went back to over and over again when we met resistance in both getting the policy passed as well as keeping the policy intact. We have had approximately 3 or 4 threats to our policy over the years, where we've had different people show up at tribal council and try and say, I want my business to be exempt from this policy, or, I think we should rescind this policy. And each of those times we had to have all of our partners and the coalition members lined up so we could flood those tribal council rooms and defend the ordinance. So it's so important to keep those partnerships in place. Be persistent in your work, and do what you can to ward off anyone that's threatening the policy. And of course, try to avoid emotions in that discussion, but also use facts. Facts you can't be competed with. So with that, I think we've got plenty of time for questions. I'm kind of curious to hear if there's anybody participating in the webinar today who has experience with policies, either, if you have your own story of what worked to enforce a different type of policy, or questions on policies that don't exist yet, or policies that do exist that you just are needing some troubleshooting help on enforcement with. I'd love to hear from the audience.
Did you see you got a Lily from Tori Whipple?
Thank you, Tori. I don't see text, Whitney. Is there a place?
If you click where it says chat, down below a box should pop up on the right side of your screen.
Aha. Thank you, Tori.
This is Tasha Peltier. I can just talk a little bit about some things that I know that have happened in North Dakota. I know that there's a similar, more of a statewide coalition that's happening amongst tribes, and this is just focused on smoke-free casinos. But I've listened to a few of their presentations, and I think the hard thing for that group is that our tribes are so dependent on that revenue from those casinos, and so when you talk about going smoke-free, they worry about, the patrons again and losing business, and how is that going to affect that income that we're getting from those facilities. And so it's really hard to, because they did a lot of work. They've done air quality studies and showed how the dangers that they're putting their employees in, and how many, because a lot of us use our casinos for community events as well. And so explaining that, we're putting our communities at risk, and it's just hard to see them put all that work into it. And then it comes back to the money thing. It's a reality, but it's just a little bit disheartening. So did you guys run into any problems like that? I know you probably had businesses that were, like you said, that were upset about similar situations maybe.
Yeah, that's a great point. So Cheyenne River does not have a casino. But we did include in the ordinance that if a casino were to be built in the future, that would be smoke-free as well, because there has been talk of building a casino for Cheyenne River. It's really a tough thing when tribes, like you said, are so dependent on their casinos for revenue. I would just love to see some really solid data out of some of the other casinos that have gone smoke-free to show that, my guess would be based on other parts of the United States that revenue will not be affected from a smoke-free air policy. And I think that one point that is worth making when you talk to your decision makers is doing a cost analysis of, how much is it costing our employees to have frequent, ear infections and upper respiratory infections, and that the health impact and the costs associated with those on the employees of those casinos. And I'm familiar with the group in North Dakota that's working on this, and I give them major props for taking this battle on. But I think that so much momentum can be gained if we can just get some really solid data from a casino that's gone smoke-free, showing that revenue remains stable. And in the meantime, I think we should use whatever data does exist. So, for example, there's in South Dakota, Deadwood has several casinos, and they showed that there was an initial reduction in revenue, but as the years went on, that was recovered, and that there was no overall loss of revenue to the casinos. So, but great question. And if anyone's involved with that group in North Dakota, hats off.
And I think that similar scare happened when bars across the state went smoke-free. They thought, oh, we're going to lose all this business, but that didn't necessarily happen. People still came there. Everybody adjusts to those kinds of changes. But yeah, and I think they did bring some data. I don't know if it was Colorado. In their presentation, they used some information, but yeah, it's just a hard sell.
Definitely.
Thanks for that, Tasha, for participating in the conversation and asking such a good question. Does anybody else have any comments or questions, or would like to share their experience with policy enforcement? Right, you talked about obviously an enforcement of a policy that could be enforced by law. A lot of the policies that we're dealing with, that I have dealt with in my experience, are organizational policies. Like, for example, where I'm from, there is a tobacco policy as far as how close to the entrances of public and tribal buildings you're allowed to be. But you still walk into buildings and have people smoking. How are some ways that community members and maybe even employees that use those entrances can help encourage their councils and their the organizations in their communities to do something about it?
Mm-hmm. Yeah, that's a great question, and a common thing once policies get passed, especially at an organization level where there's not necessarily anything you can do as far as violations go. I would say really empowering the employees of that organization to speak out against it. And like I said, it's a really hard conversation to have. I am known as like the tobacco Nazi here on Cheyenne River. Because of all the tobacco work that I've done. But even for me to have those conversations with people when I see somebody smoking where they're not supposed to, it's really a hard thing. Actually, I was in Las Vegas for a conference at one of the casinos, and it was a tribal organization, and we were not on the casino floor, but on one of the upper levels where there was an elderly Native man in the hallway of this casino smoking. And of course they allow smoking on the casino floor. But we were on like the conference area of this casino, and I smelled it a mile away, and I just had to go be nosy and check it out for myself. And there's this elder like sitting at this table smoking. And I was like, oh no, what do I do? Like, he really shouldn't be here. And like, there's kids around and I really want to say something, but he's an elder. So it's such a hard conversation to have. And I turned around and I thought, well, I'll just go get somebody that works here to go talk to him, because it'll come better from them. And then I stopped myself and I thought, I can handle this. So I just walked up to him and I said, were you aware that, smoking's not allowed on this floor of the casino? And he says, well, who are you? Like, who are you to tell me this? Do you work here? Are you, part of this conference committee? And I said, no, I'm just a concerned person that, and I don't want you to get in trouble. If you try and tell them like you're their friend. I said, I just noticed there's a no smoking sign down at the end of the hall and thought you might like to know. And he's like, oh, okay, well, thanks for that. And he put a cigarette and that was the end of it. So it's really a hard conversation to have when you do have to enforce a policy. But like I said, if you can make people feel like they're in the majority, that this is something that everybody wants and you're doing everybody a favor by speaking up against it, I think that's one big step that's helpful. And also getting that message to come from the right person. So as a coalition, it wouldn't be appropriate for us to send an email to all the IHS staff, for example, in our community here saying, remember your organization is smoke free, but rather what we'll do is write that email of the friendly reminder, send it to the CEO of IHS and say, hey, can you send this around to all of your staff? So sometimes it's just getting it to come from the right person to where it has a little more power behind it.
Okay, good. Thank you for that. I think one thing to point out that's been a theme throughout your presentation and what you were saying is really coming from a place of caring and a place of love when you're having these conversations rather than, accusing people of killing the other community members or, whatever,
right.
or pointing out how terrible, tobacco is, but coming from a place of solution and a place of positivity rather than a place of a source of attack or a place of, well, you smokers are doing this wrong, or whatever the policy may be about. So anyways, I just think I'm glad to hear that, because so many times in our Native communities, we hear about all the things that are wrong rather than coming from a place of solution and a place of positivity. So thank you for that. Are there any other questions before we wrap up? Okay. Sorry. So I did find out next month our community health webinar will be HRSA, one of their representatives, the Health Resources and Services Administration, will be presenting for our webinar next month. And if you're not on our listserv for the community health webinar series, you can leave your email address in the chat box, and I will follow up with you and get you added to our list. And then also, right after this, I'll be uploading this webinar, which has been recorded onto YouTube, and I'll be sending out a link so that you can share this with others. And you can follow up with me via email also, whitney.nordbold@gptchb.org, to get your questions answered or to get any information about other community health webinars or future ones that are coming. Ray, would you be willing to share your your slides with me so I can send those out with the email?
Absolutely. Yep, I will send the link as soon as we hang up here.
Perfect. Okay. Also, I put the SurveyMonkey link, the evaluation link, in the chat box, but that will also be attached in the email that I send out later with the YouTube link for the video. So I think that is it. Thank you so much, Ray. You did an excellent job, and this is really valuable information for us here at the Health Board and the work that we do, as well as our constituents. So thank you so much for your time today.
Yeah, thank you guys all for having me. I hope everyone can take something away from the presentation today.
Yes, it got me thinking about some of the policies that we're working with other organizations. So I think that will be useful for us.
Great.
All right. Well, everybody, you have a great day, and we will see you next time.